Hello, my name is Lynn Marie Jarrett, and I'm a fourth year medical student here going into neurology. And this is going to be my case study for the neuroradiology rotation. And I'm excited to tell you guys about a really interesting finding that I saw called Parakinesis Brachialis Oscitans. We'll go ahead and jump right into how the patient presented. So this patient, family, found her, she'd been down for 3 days at home. They weren't able to get a hold of her. They called EMS. She was found to be completely flaccid on the left side of her body. So of course a stroke code was called on her, and she was found to have a right-sided MCA stroke. So this 63-year-old female had a lot of other stroke risk factors. She had coronary artery disease, atrial fibrillation, hyperlipidemia. Unfortunately, that 3-day post-stroke presentation, she was way outside of the window for the TPA or the thrombectomy, so unfortunately not able to do a lot to help her, but she had a pretty classic right-sided MCA presentation. Her NIH score was 14, an aspect score was 5, and a CTA also found she had a right-sided ICA occlusion. So we can go ahead and go through her imaging first. Here's the CTA that shows that right-sided internal carotid artery occlusion. So it goes all the way from the petrous segment to the supraclinoid segment. You can see on the left side there, much more patent, but right side not looking so good. Up a little bit higher, you can see the anterior communicating artery is helping that right side out a little bit. We've got some blood flow. We can see some contrast, definitely more clearly on the right side of that ACOM there. So here was her presentation a couple days into her hospital stay. And this is, I believe, about at the level of the foramen of Monroe. You can see she's got a midline shift of about 4.1 millimeters. So swelling definitely occurring on that right side, pushing tissue around. And here's a view just to try to give you a better idea of where exactly the tissue loss occurred. So a lot of it was from the right anterior temporal lobe all the way up into the basal ganglia and the internal capsule. So hopefully between those two views you can kind of get an idea of which volume was lost. So the interesting part of this case was actually about 11 days after her initial presentation, when she was transferred to the Loveless UNM inpatient rehab facility, where the physical medicine rehabilitation team was working with her. We were doing a routine exam and noticed that when she yawned, her otherwise completely flaccid left upper extremity exhibited about a 4 out of 5 contraction in the biceps. And this was not reproducible. We tried showing her videos of people yawning to get the contagious yawn effect. Unfortunately, it was not replicable in that manner, but a few days later, when she yawned again during an exam, we noticed that the exact same type of flexion occurred, about the same level of strength, the same amount of time, all of that. So very interesting finding. So we decided to kind of look into this. So that's when I started digging through Pubmed and found that this phenomenon is called Parakinesis Brachialis Oscitans. It was first documented in 1794, typically occurs with stroke patients, although a few other types of brain injury have been documented. And very few total things have been published about this. It seems to be pretty uncommon for you to get just the right amount of tissue loss for the arm to still move and the patient to still yawn and this movement to occur. So I'm definitely going to talk about what we know about it and what we don't know about it and why this is so interesting. So yawning, I didn't know this until I started researching, but it's phylogenetically ancient. Pretty much all organisms that are capable of yawning do yawn, and it looks like the stereotyped yawn that you would think about a human doing. So the mouth opens really wide. Here you can see a reptile having a yawn reflex. You can see the diaphragm is going down into the abdominal cavity, and all of those muscles that we stretch when we yawn are also stretched in reptiles and fish and other mammals. So very ancient reflex. And another interesting thing in quadrupeds, you can see here this is a university that was studying horses on treadmills. As their front and back limbs flex during running, The limb flexion is actually synchronized to the expansion of the diaphragm, not quite in a yawn reflex, but there is a synchronization that occurs involuntarily between the contraction of the limb and the expansion of the diaphragm. So again, this doesn't include a stretching of the mouth and the oral muscles like you would see in a yawn, but this is going to become important when we talk about why it might be occurring that the limb is flexed during a yawn, because the diaphragm and the extremity limbs seem to flex together in a more primitive reflex. Humans are an interesting case, of course, because we are bipeds and not quadrupeds. So what happens to this reflex when you start having a very different timing between when your feet strike the ground and when you need to take a breath for your muscles to stay optimally oxygenated? So in humans, this reflex, we don't really see it when we study runners on treadmills and we're checking the respiratory rate and the running speed. It seems to be pretty much gone, but it would be not outside the realm of possibility to think that this reflex, some piece of this reflex arc would still be present, within the nervous system that might be reactivated if you had tissue damage in the right areas. So I think about this kind of like a frontal release sign when we have a demented patient. If you tap the forehead, they can't control their blinking. If you stroke a finger into their palm, they'll exhibit a grasp reflex, much like a very young baby. Again, if you strike the palm, their mouth will twitch a little bit to the side, like the pulmomental reflex also exhibited in infants. So when you lose that frontal lobe matter, you have loss of inhibition of these more primitive reflexes. So that's one of the prevailing theories about why this might be occurring. Yawning itself is really complex and people are still debating, and the scientific community doesn't really have a consensus about all of the reasons that we yawn. But reflex yawning itself has been documented in patients with basilar artery occlusions that were fully locked in. So that's really fascinating and points to possibly even spinal cord level reflexes potentially that control some of these reflex muscle movements. Or an upper level reflex that somehow, wasn't involved there. Interestingly, there also seems to be some dopaminergic activation and modulation of yawning reflexes. Yawning is often lost, especially in more advanced Parkinson's disease patients. They just kind of stop yawning. Also, some neuroleptic treatments that also, of course, operate on dopaminergic pathways. Those seem to also alter whether patients are able to spontaneously yawn. So we don't really know exactly where in the brain the yawning reflex is controlled. Is it a more diffuse process? Is it, a very interconnected process? Hard to say exactly. But one of the leading theories right now about why this Parakinesis Brachialis Oscitans occurs is kind of what I was saying with the frontal release signs, that maybe you're losing some inhibitory function near the internal capsule or that's involved in the internal capsule, or the basal ganglia, since those areas seem to be most commonly involved when this clinical finding is seen in patients, and we go back to look at the neuroimaging. Maybe loss of that is actually allowing this more primitive reflex to occur. So really fascinating and really useful for our patients in the rehabilitation sense. One case report I saw that was published fairly recently actually talked about a patient who was able to sort of on command fake a yawn and have reflex movement like that with his bicep of the upper extremity that was otherwise flaccid. And he was able to use that to really assist himself in rehab to get that arm closer to his body long enough to help him move without having to drag a flaccid limb around. So I think if we study this phenomenon a little bit more, there also might be some implications for prognosis. There was a little bit of conflicting evidence and definitely not enough overall data, but some reports have suggested that it is more likely for a patient to be able to eventually gain back full voluntary control of the limb when they have Parakinesis Brachialis Oscitans. There was one case report that discussed a man who was able to sort of yawn on command and was able to have flexion in his fingers and was able to do more fine motor movements of the hand only during the yawn. So very interesting, and again, just sort of sparse case reports, 10 things on Pubmed that use this particular phrase. But really fascinating, and hopefully we can get a few more case reports about this and go through it and look at the neuroimaging and really try to figure out exactly what tracts are involved and try to identify a little bit more about this really fascinating reflex. And that's all I have on this presentation. And so please feel free to send me emails with questions. I'd be more than happy to answer anything or securely message anybody the MRN of this patient if you'd like to take a much closer look at any of the imaging findings that I showed. She had quite a few head CTs in there, so certainly would be happy to have any more feedback that you guys have about this. Thank you for your time.